feels like summer in April. It's so hard to look at you and respond with a sigh of relief. A hallway is not a hallway without a laughing student. A classroom is not a classroom without a teacher's uplifting words. Your presence is the light at the end of the tunnel. Your smile is the tree so vast it creates the shade. Your words so lasting, impacting, always. A building can never be called a school without you. Thank you for you.
Hi, students and families. The team at Star National Academy George misses you all very much, and they have a message for you.
Hi, friends. It's Mrs. Bell. I miss you very much. I hope you're having fun. I hope you're being safe, and I hope to see you soon.
Hi, everybody. I just wanted to let you know that this is a great time to explore your world when the weather warms up, and you can read things. You can read street signs and things like that. I also wanted to tell you that I miss you. I miss your smiling faces and hugs in the morning, but I will see you next year. Bye.
السلام عليكم. Hello, how are you? مرحبا. صديقي بده يقلكم هو كتير بحبكم. Start where you are. Use what you have. Do what you can. See you inshallah very soon. Bye bye. Say bye bye.
Hey guys, miss you. Hope you're all doing well. Don't forget, stay active, stay strong.
Hi boys and girls, it's Miss Bazzi. Just want to let you know I miss you guys all very much. Please stay home and stay safe.
I want to tell my students that I miss you and I love you so much. Stay safe, stay positive, stay strong. I love you all and looking forward to see you all in the fall. Stay safe. 1A rock.
Hi, SIA, Miss Costa. I hope online learning is going great for you. I miss you all so much, and I can't wait to see your smiling faces.
Hello, boys and girls. I want to tell you I missed you all. And remember to be positive, be kind, and be thankful, and stay happy. Bye.
Yes. Hi, guys. I miss you all. I'm Mrs. Peter. Everybody I miss. Bye.
Guys, I miss you.
Hi, everyone. I miss you, and I miss seeing your smiling faces.
Hi, everyone. I wanted to let you all know that I am thinking about you, and I miss you all so much. Keep making music and stay safe, everyone.
Hello, my friends from Star International Academy George and beyond. This is your library teacher, library in my shirt there. And I just wanted to send you a message where I would like to tell you that I miss you very much. I love you very much. I want you to know that you are very dear and special to me. And I want to remind you, please, to stay healthy, to stay safe so that we move out of this crisis as soon as possible.
Hello everyone, this is Mr. Hassani from Food Service. I really want to say that we really missed you in the lunchroom, and I hope you're being safe, and I hope to see you again. Bye for now.
Good morning, dear parents and guardians and families of HES Academies. This is Mr. Wissam Sharafuddin speaking, the Family Engagement Community Liaison, and with us, Dr. Ali Ajami, the Family Engagement and Community Liaison, also of the HES Academies. We welcome you to another live Family Engagement broadcast, and we have an exciting program for you today. نرحب بكم في البث المباشر للمشاركة الأسرية لمدارس مؤسسة حمادة التعليمية، ولدينا برنامج ممتع لكم اليوم. قبل أن نشرع بتقديم ضيوفنا أقدم لكم الدكتور علي عجمي.
Dear families, students and staff of Hamadi Educational Services, dear viewers everywhere, good morning and Ramadan Kareem, and welcome to our Family Engagement live show. It is not a secret that we are passing through very tough times. We have to admit that almost every aspect of our life has changed dramatically. Everything is changing around us in high speed, and we have to admit as well that our lives in the coming future will never be the same as before. It is true that this tiny little thing, the coronavirus, has devastated almost everything around the globe. Death toll is rising worldwide, economies are collapsing, billions of people are confined in self-imprisonment, but we could see positive aspects as well. For the first time since decades, families are much closer together. We had tremendous complaints before that a family is rarely meeting together and each member has his own private life. Now we are spending most of the day together. I believe it's a great opportunity to come, to talk, to see how to cope with the sudden circumstances and changes we are facing. The theme of our session today falls within this. أعزائي الأهالي والطلاب والموظفين في مؤسسة حمادة التعليمية، سأترككم الآن مع زميلنا وسام شرف الدين ليقدم لنا ولكم ضيوف هذه الحلقة.
Thank you, Dr. Ajami. Today's program is brought to us by LAHC, Enriching Lives and Embracing Diversity. I'm happy and proud to present to you Mr. Wasim Mahfouz with us. Wasim Mahfouz is a proud immigrant who's never taken the American dream for granted. He holds a Bachelor of Arts in Hospitality Management and has acquired graduate studies in Human Resources and Organizational Development from Eastern Michigan University and a master's degree in Public Administration with honors from the Rackham School of Graduate Studies at the University of Michigan. He has been involved in social work and community service at a young age, where he served as a volunteer paramedic with the Lebanese Red Cross. Upon his arrival in the United States, Wasim became actively involved in the community. For the past 15 years, he has served as the executive director of LAHC and continues to be committed to the cause he works for, taking pride in helping to preserve, unite, and advance the future generations of the community. He has also served as an assistant to the Wayne County Executive and a liaison between his office and the community for a tenure that lasted 10 years.
Without further ado, welcome Wasim Mahfouz.
Welcome, Wissam. Hello, Dr. Ajami. Thank you for having me today.
So what do you have for us today? Can you tell our parents about the presentation today?
Well, first and foremost, I would like to wish the entire Muslim community a Ramadan Mubarak, and these are definitely some challenging times that we're going through. I would like to offer my deepest condolences to all those who have lost their battle to COVID-19 and all the families that have been affected dearly by that, and our full support to those who are still fighting the good fight. And inshallah, we will be able to overcome this obstacle. We are fighters by nature, and inshallah, this too shall pass. Today's presentation is going to be about COVID-19 and mental wellness and substance abuse prevention. And like Dr. Ajami mentioned prior in his presentation, we have many. The complaint before was we're not spending enough time with families and friends, and now with this lockdown. Many of us are unable to see our loved ones and friends and be able to live our life freely and in a normal way. This too is putting a lot of toll and a lot of pressure on many families. Anxiety, the fear of the unknown. We don't know what's going to happen. Those of us who have kids, we're afraid to leave the comfort of our home to go and do some basic work and provide basic necessities, as simple as going to the grocery store, in order not to bring any viruses or any germs back to our little ones and our family. So today we dedicated this session to address the topic of mental wellness as well as substance abuse prevention during COVID-19. I will be joined by two of my colleagues at LEHC, our substance abuse prevention program manager, Maryam Ismail, as well as our prevention specialist, Umniya Abdullah, who will be talking more in depth about this topic.
Thank you, Wasim, and I'm happy to introduce both Maryam and Umniya. Maryam Ismail, she's a substance abuse prevention program manager at LAHC. She holds a Bachelor's of Arts degree in psychology from the University of Michigan and a Master of Science in Health Service Administration from Central Michigan. She has also taken a doctoral level classes in leadership and healthcare organization. She has been working in the Arab American community since 2010, where she was the public health coordinator at Access Community Health and Research Center, coordinating substance abuse prevention and tobacco reduction programs through state and federal funding. She is a committee member on United Healthcare Community Advisory Team to represent the Arab American population and the community she serves. Maryam is certified prevention specialist by the Michigan Certification Board for Addiction Professionals, and she strives every day to promote drug-free communities. Her bilingual and culturally sensitive approach makes her a trusted professional in the community she serves. Welcome, Maryam.
Thank you so much for having me. Thank you.
And also we have Umniya with us. Umniya, she's a substance abuse prevention specialist at LAHC. She holds a Bachelor of Science degree in biology from Oakland University and a Master's of Science in healthcare, in health science with a public health concentration from Touro University worldwide. After exploring different aspects of healthcare and education, Umniya landed this position, allowing her to influence the health of the community through prevention. Once a refugee, Umniya has taken her past experience and bilingual skills and applied them, understanding and improving the lives of people in the diverse local community. She is a familiar face in many high school classrooms as she facilitates the life skills program and also familiar with parents through different parenting engagement sessions. Welcome, Umniya.
Thank you. Thank you for having me.
So both of you have been in our schools and have served our population. We thank you for that. And now I'll leave the floor to you for the presentation, which will be both in Arabic and English. And parents have the opportunity to participate by questions, either in Arabic and English in the comment section on any platform that you are using to see this presentation. Thank you.
Thank you. So welcome everyone. Like he said, I will be sharing a presentation with you today. I will be doing it both in English and in Arabic. So our first slide would be in English, and then it will be followed by the same exact slide, but in Arabic. So today we're going to be talking about mental health, substance abuse prevention, and also coping with COVID-19 and every changes that's happening around us today. So أهلا وسهلا فيكم. مثل ما قال نحن رح نعمل presentation اليوم عن الصحة العقلية والوقاية من تعاطي المخدرات وكمان التعامل مع COVID-19. رح نعمل السلايدز بالإنجليزي وبالعربي. So أول سلايد رح تكون بالإنجليزي واللي بعدها رح تكون بالعربي. So to get started, so what is COVID-19 and mental health? So the current outbreak that's happening right now has caused a lot of changes to our daily lives. Those changes can be seen through our certainty about the future, the alteration that's happened to our daily routines. They're definitely not the same as they used to before. We also are facing a lot of financial pressure and social isolation. All of these changes together are causing a lot of negative emotions to a lot of people. Those emotions include stress, anxiety, fear, sadness, loneliness, and even helplessness. And these negative emotions can directly feed into causing worsening cases of mental health illnesses or even creating a problem to start with. So فيروس كورونا والصحة العقلية. So فيروس كورونا سبب تغيرات كثيرة بحياتنا. من هدول التغيرات هن عدم معرفة المستقبل، تغير الروتين اليومي. So حياتنا اليومية تغيرت كثير ومنا مثل قبل، وكمان صار عندنا ضغوط مالية كثير. في ناس كثير خسروا شغلهم وما عندهم income مثل قبل، وكمان في عزلة اجتماعية. وكل هدول التغيرات اللي صاروا بحياتنا ممكن يسببوا مشاعر سلبية. من هدول المشاعر في الضغط، القلق، الخوف، الحزن والوحدة، أو كمان العجز. So هدول المشاعر السلبية ممكن يؤدوا أو يسببوا لتدهور حالتنا الصحية، خاصة صحتنا العقلية. So knowing that all these changes can, affect us, affect our mental health, how do we know if we actually need help? So here we're going to go over a few different signs and symptoms of things that you might be going through, and if you are dealing with one or more over, an extended period of time, maybe it's time to think about maybe seeking help or, talking to someone about these signs and symptoms that you're experiencing. One of them is trouble concentrating on typical tasks. So before COVID-19, if you were able to concentrate for a long time and, go through your day without any trouble, but you can't right now, maybe this is a sign or a symptom of, mental health changes that you're facing. Change in appetite is another one. So you might be experiencing an increase in appetite or a decrease. You might also be facing body aches and pains, especially unexplained ones, difficulty sleeping, or even struggling to face your daily routines. So before you could have been used to having a daily routine, finishing your tasks every single day, but you might be struggling with them today, and that's due to all of the stressors and the changes that we are dealing with because of COVID-19. So شو هي التغيرات اللي ممكن نحس فيها بسبب الكوفيد-19 وكيف نعرف إذا نحن محتاجين مساعدة؟ So إذا بتحسوا هدول التغيرات أو العلامات أكثر من يوم لمدة مستمرة، ممكن هذا الشيء لكم إنه لازم تسألوا لمساعدة أو تحكوا مع أي حدا من رفقاتكم أو عائلتكم على هدول التغيرات. واحد من هدول الأعراض هي مشكلة في التركيز على المهام اليومية أو تغيرات بالشهية. So ممكن يكون شهيتكم مفتوحة أكثر أو أقل من قبل. ممكن يكون عندكم آلام بالجسد وخاصة آلام بدون سبب. ممكن يكون عندكم صعوبة بالنوم أو حتى صعوبة لتكملوا شغلاتكم اليومية. So what can I do? So now that we know that, there are certain changes that we can be facing, what can we do to kind of help ourselves not fall into any of these changes, not fall for any of these symptoms, and kind of just protect our mental health overall? So one of the most important things that you can do is try to keep up with your regular routine. So if you are used to getting up in the morning every single day about 8 o'clock, make sure that you're, staying around that 8 o'clock, getting up in the morning, changing your clothes, not sitting in pages all day, and trying to, stick to your regular routine. That will really help a lot. Another important thing is to try to limit your exposure to news and media. With COVID-19, there's a lot of misleading information out there through social media and even the news. So it's really important for you to sometimes just kind of take a break, as a lot of these, misleading information can cause stress or even anxiety. Staying busy is another really helpful tip. So if you have absolutely nothing to do, you can try to pick up a new hobby, learn a new skill, or even do tasks that you've been wanting to do for a long time, but you never found the time. Remaining positive is another important tip. So with all of these changes, it's really easy for us to fall into the negative thoughts. We don't like our routines. We don't like the fact that we can't see our loved ones. We don't like the fact that we can't go outside and do our regular activities. But it's really important to try and think about it in a more positive way. So for me, I can say, you know what, like I'm at home. I haven't left the house in a month. It really sucks. But you know what? I get more time to spend with my family, and that's a positive thought to have. It could be as simple as that. Connecting with others is a really important thing as well. So we all have access to internet and a lot of virtual means for connecting with other people that we love, so our friends and family. So make sure that you're staying connected with them. And reaching out for help is also another really important thing. So again, like we said, if you are noticing any of these signs or symptoms, it's really important to talk to your loved ones, your family, friends, or even seek professional help if you are experiencing any of these symptoms. So شو ممكن نعمل إذا في عنا أي واحد من هدول الأعراض اللي حكينا عنهم، أو شو فينا نعمل نتجاوز هدول الأعراض. So أول شيء فينا نعمله هو إنه نحاول إنه نحافظ على روتيننا اليومي. So إذا نحن متعودين إنه نفيق كل يوم الساعة 8 الصبح، خلينا نتعود على هذا الروتين ونخليه كل يوم نقعد الساعة 8 الصبح. لازم كمان نحط حدود لتعرضنا للأخبار وكمان لوسائل الإعلام. بهالوقت خاصة بوقت COVID-19 في إشاعات كثيرة ومعلومات منا صحيحة على الإنترنت، وهدول المعلومات ممكن يسببوا لنا للخوف أو القلق. لازم نقلل من استخدام وسائل الإعلام وكمان استماعنا للأخبار. كمان فينا نشغل حالنا بمواهب جديدة، ممكن نتعلم مواهب جديدة، أو ممكن نجرب هوايات جديدة، أو فينا نعمل أشياء كان بدنا نعملها من زمان بس ما كان عندنا وقت. شيء تاني لازم نعمله إنه نفكر بطريقة إيجابية. بهالوقت من السهل إنه نحن كلنا نكون حزنانين وضايجين لأنه ما عم نطلع من البيت، ما فينا نروح على الشغل، ما فينا نروح على الجيم أو نشوف رفقاتنا. بس لازم نفكر بطريقة إيجابية. لازم نقول نحن هلا قاعدين بالبيت، هذا الشيء نحن ما حابين هاي الفكرة، بس عم بيعطينا وقت لنقضيه مع أهلنا ومع الناس اللي بنحبهم. كمان في شيء تاني مهم إنه هو نتواصل مع الآخرين. نتواصل مع رفقاتنا وكمان عائلتنا. وفي عنا كثير مواقع إلكترونية فيها تساعدنا لنتواصل معهم، فخلينا نستخدمهم نضل نتواصل معهم. آخر نقطة بهاي السلايد إنه لازم نسأل للمساعدة لما بنحتاجها. إذا عنا أي وحدة من هدول الأعراض بطريقة مستمرة، ممكن نحكي مع رفقاتنا، عائلتنا، أو حدا من المختصين العقليين إذا عنا أي واحد من هدول السيمبتومز أو الأعراض. What if I can't get help? A lot of times we don't know that, these signs and symptoms actually mean that we have, mental health problems that need to be addressed. Other times we are ashamed or we are too scared to kind of address those problems because they can be a little bit shameful and, not something that we want to talk about. So what can happen if we don't get help? A lot of times people who struggle with mental health turn into unhealthy strategies to try to cope. The main unhealthy strategy is using drugs as a form for self-medication. So a lot of times addiction and mental health disorders kind of go hand in hand. That means someone who has a mental health illness or problem is more likely to be at risk for using drugs, addiction, or even trying them. So leaving those mental health illnesses untreated, unaddressed can lead to someone trying drugs, can lead to worsening of their mental condition, can lead to addiction or even suicide in the long run. So شو ممكن يصير لما نحن ما بنحصل على المساعدة اللي بنحتاجها؟ في كتير من الأحيان لما نحن ما بنعرف شو هن هدول الأعراض اللي ممكن نحسهم لما يكون عندنا مشاكل عقلية، أو في كتير من الأوقات نحن بنكون خجلانين أو ما بنحب نحكي عن مشاعرنا أو التغيرات اللي عم بتصير بحياتنا اليومية. شو ممكن يصير؟ الناس اللي عندهم أو عم بيعانوا من صحتهم العقلية فيهم يجربوا إنه يستخدموا أدوية كشكل ليعالجوا حالهم بنفسهم. كتير من الأحيان الاضطرابات الصحية العقلية بتجي مع الإدمان، هدول الشيئين بيجوا مع بعض. شو يعني الناس اللي عندهم اضطرابات صحية هن بخطر أكتر للإدمان ولتجريب المواد المدمنة. لما بنترك لما بنترك صحتنا النفسية بدون علاج لوقت مستمر، حالتنا النفسية رح تتدهور أكتر، وكمان ممكن يصير عنا إدمان أو ممكن نجرب الانتحار. So what are other reasons that people might use drugs? Yes, one of them is, mental health illnesses that are not treated properly, but there are also other reasons. One of them is to escape our pressure from normal everyday life and even the stress that we are facing on a daily basis. And unfortunately, today we have a little bit more stress just because of all of the COVID-19 and the uncertainty that's happening at this time. A lot of other times people might like the feeling of using drugs or other addictive substances. They might be really bored. I think a lot of us are at this time. Some people might use drugs to try to fit in. So, all my friends use drugs, all my friends smoke marijuana. I want to try it too. I want to be like them. So that's another reason for people to try to use drugs or even experiment with them. That leads me to my other point. So experimenting is another reason. So a lot of times we hear about drugs, we hear about all these substances, and it can be really intriguing, and someone would want to try and experiment and see what it's like to use any of these substances. So a lot of times people start with using these drugs or substances as a way to relax themselves, but in the long run, these substances can become the cause of the problem, and they no longer relax the person, as they bring a lot more problems in the long run. So شو هي الأسباب الثانية اللي بتخلي الناس تستخدم المخدرات؟ مثل ما قلنا السبب الأول إنه عندهم اضطرابات صحية خاصة مع وصحتهم النفسية، فممكن يحاولوا إنه يعالجوا نفسهم بنفسهم بطريقة استخدام الأدوية أو المواد المدمنة. في غير أسباب كمان. في سبب مهم هو الهروب من الضغط والستريسرز تبع حياتنا اليومية، وخاصة بهذا الوقت، وقت فيروس كورونا. في ضغوطات كتيرة علينا، ولنتخلص من هدول الضغوطات في ناس ممكن يحاولوا يستخدموا المخدرات ليتخلصوا منهم. في ناس بيحبوا الشعور اللي بيحسوه بعد ما يستخدموا المخدرات أو المواد المدمنة. في ناس كمان ممكن يستخدموها ليتخلصوا أو يخففوا من الملل، وهلا بهذا الوقت كلنا قاعدين بالبيت ونحن ملانين أكتر من قبل، نحن متعرضين أو في عنا ملل أكتر، فممكن نستخدم المواد المدمنة. وكمان في ناس ممكن يستخدموا هدول المخدرات لمجاراة رفقاتهم. نحن بنعرف مثلا أنا عندي رفقات كلياتهم بيدخنوا، أنا بدي أقول أنا بدي أدخن، بدي أكون مثلهم. أو في ناس بدهم يجربوا هدول المواد المدمنة أو السجاير أو أي شيء. كثير من الأحيان في ناس لما بيجربوا أو لما بيبدوا يستخدموا هدول المخدرات أو المواد المدمنة بيستخدموها لأنه بتسبب لهم الراحة، بتخليهم يسترخوا. بس بعد ما بيستخدموها أكتر من مرة، هدول المخدرات أو المواد المدمنة بتسبب لهم لمشاكل أكتر مما كانت قبل. So now that we know, we're prone to, trying drugs or other addictive substances, let's kind of learn about what can actually happen to us when we do so. So most drugs affect our brain reward system. So almost 99 to 100% of drugs directly affect our brain. So normally, without any drugs, we get a release of dopamine when we do something that's pleasurable, that makes us happy, that makes us comfortable. So it could be eating, hanging out with people that we love. And dopamine is a neurotransmitter, something similar to a hormone, but it's associated with a feeling. It's associated with a happy feeling. So this circuit involves the dopamine, like I said, and it gets released to allow a person to feel good. So once we feel good, we're going to associate the action that made us feel good with that release. So since this process occurs when people use drugs, they're more likely to use it more often because that drug is also going to allow them to release more dopamine and make them feel happy. So هلا بنعرف كيف ممكن الناس بيبدوا يستخدموا المخدرات أو المواد المدمنة. لازم نعرف شو هدول المواد بيسببوا لدماغنا بشكل عام. So معظم الأدوية أكثرهم يمكن 100% منهم بيأثروا على دماغنا بشكل مباشر. So بطريقة عادية بدون أي مخدرات أو أدوية دماغنا بيطلع مادة وهي مثل الهرمون نحن بنسميها ناقل عصبي اسمه الدوبامين. وهذا الدوبامين بيخلينا نحس بفرح أو باسترخاء. So أكثر الأحيان لما بناكل أو لما بنقضي وقت مع رفقاتنا والناس اللي بنحبهم هذا الدوبامين بيصير إفرازه بدماغنا. So بس نحن بيصير عنا دوبامين بدماغنا نحن بنقول أنا كنت عم بقضي وقت مع رفيقتي وأنا كنت فرحانة فبدي أقضي وقت معها أكثر من شان أحس نفس هذا الشعور. هذا الدوبامين أو الناقل العصبي الأدوية كمان بتسبب لإفرازه بالدماغ، وهذا اللي بيؤدي للناس لتستخدم الأدوية يوم بعد يوم من شان يحسوا نفس هذا الإحساس. So after using drugs and other addictive substances for extended period of time, it can cause addiction. So what is addiction really? So as a person keeps using drugs, our brain is going to adapt to that same level of dopamine release. And after a few days, even weeks, our body is no longer going to think that that amount of dopamine is sufficient. So what are we going to do? We are more likely to use more of the drug to kind of reach that same level of dopamine, of happiness, of comfort. So what is addiction? Addiction is a chronic disease, and we categorize it by a compulsive behavior. So a lot of times people can't really control any of these behaviors, even though they know that using that drug, smoking that cigarette, or whatever it may be, can really have harmful consequences on their bodies and their brains as well. So شو هو الإدمان؟ مثل ما قلنا بعد ما نستخدم المخدرات أو المواد المدمنة لشكل مستمر دماغنا رح يتعود على نسبة الدوبامين الموجودة، وبعد كم يوم هاي النسبة ما رح تكون كافية لتخلينا نحس بفرح أو بانبساط مثل ما كانت قبل. So شو الواحد رح يعمل؟ رح يبدأ ياخد كمية أكبر من هدول المواد المدمنة أو الأدوية، وهذا الشيء رح يسبب الإدمان. So شو هو الإدمان؟ هو مرض مزمن، وأكثر الأحيان هو الشخص اللي عنده إدمان ما بيقدر يسيطر عليه، حتى لو هو بيعرف إنه لما بياخد هذا الدواء أو لما بيدخن هاي السيجارة رح يكون عنده عواقب ضارة لصحته. So let's look at a little bit of different drugs and their effects on our body. The most popular one, cigarettes and other tobacco products, is also includes vapes. So for parents, if you are aware that teens are into vaping today, same effects will happen to them even if they are using an electronic cigarette that's delivering that tobacco to their system. So a lot of times cancer is caused by smoking cigarettes or any other tobacco products. This also includes hookah as well, along with breathing problems and other effects all over our body, because that directly affects our lung, and that kind of spreads all over our body. Marijuana is another very common one today. So this can lead to difficulties when it comes to problem solving. It can impair our memory, can cause breathing problems, and also can harm our brain development, especially for young teens and people that are under the age of 25. Cocaine and other different stimulants can speed up our heart rate, and that can put more pressure on our heart, which can, in the long run, kind of lead to heart attacks, strokes, and even death. Alcohol can lead to cirrhosis of the liver, and that's just scarring of our liver, cancer, strokes, and even death if it's used over a long period of time. Opioids, which include heroin and prescription drugs, strong prescription drugs, or medications, can lead to dizziness, vomiting, slowed breathing, and also death in the long run. هلا راح نحكي عن مواد مختلفة وتأثيرها على صحتنا. أول مادة راح نحكي عنها هي السجاير أو التبغ، وهدول بيضمنوا السجاير الإلكترونية يلي هن كمان ممكن يسببوا أنواع مختلفة من السرطان، وممكن تأثر على تنفسنا وأعضائنا الجسدية كلياتهم. الماريجوانا كمان شيء هلا كتير ناس عم يستخدموه، وهي ممكن تسبب صعوبات لحل المشاكل، ممكن تسبب بضعف الذاكرة، وكمان ممكن تسبب مشاكل بالتنفس أو حتى تضر نمو الدماغ، خاصة للناس اللي عمرهم أقل من 25 سنة. الكوكايين أو غير منشطات تشبهها ممكن تسرع عدد دقات قلبنا، وهذا الشيء ممكن يسبب لضغط أزيد على قلبنا، وبعد مرور وقت ممكن يسبب لنوبات قلبية أو سكتات دماغية أو حتى الموت. الكحول ممكن يؤدي لتليف الكبد، السرطان أو السكتات الدماغية، وكمان لما بنستخدمها بطريقة مستمرة ممكن تؤدي للموت. المواد الإفيونية اللي هي الهيروين أو الأدوية الموصوفة من عند الدكاترة ممكن إنه تؤدي لدوخة، ممكن تبطئ تنفسنا، وكمان ممكن تسبب الموت لما بنستخدمها بطريقة مستمرة. So how is all of this, how are all of these drugs related to COVID-19, and why is it really important to talk about it today? It's important because a lot of times people, what they don't know is that when we smoke tobacco, marijuana, or use any of these other drugs, it can directly affect our breathing system. So it can affect our lungs. So that makes complete sense because COVID-19 is a virus that attacks our respiratory system, specifically our lungs. So if our lungs are already not as healthy as they can be because we are smoking, using tobacco, or any other substances, it can really put us at a higher risk of, experiencing more severe symptoms and having a harder time overcoming this virus. So there are a lot of studies that, show a correlation between COVID-19 and more severe symptoms, but that doesn't mean that every single smoker is going to get COVID-19. It simply means that you're more prone to getting COVID-19, and you're also going to have a harder time fighting it off simply because your respiratory system is a little bit weaker than someone who does not smoke or use any substances. So it's really important at this time to kind of think about the risks and benefits of using tobacco, marijuana, or any other drugs, and really consider quitting or reducing the amount of use. So ليش هلا لازم نحكي عن تعاطي المخدرات خصوصا بوقت كورونا فيروس؟ So في شيء الناس لازم تعرفه إنه استخدام التبغ، الماريجوانا أو غير المخدرات ممكن تأثر على صحتنا، وخاصة ممكن تحطنا بخطر أكثر يصير عنا فيروس كورونا. ليه؟ لأنه الناس اللي بتستخدم التبغ، الماريجوانا أو غير مخدرات، الرئتين تبعهم بيكونوا أضعف من الرئتين تبع أي واحد ما بيستخدم أي مواد مدمنة، ونحن بنعرف إنه فيروس كورونا بيأثر على جهازنا التنفسي بشكل عام. لما بيكون عندنا واحد الرئتين تبعه ضعاف منه قواي، هو ممكن يصير عنده أعراض أقوى من أي واحد ما بيستخدم المخدرات أو التبغ. هذا الشيء ما معناه إنه كل الناس اللي بيدخنوا، كل الناس اللي بيستخدموا المواد المدمنة رح يصير عندهم كورونا. هذا معناته إنه الناس اللي بتستخدم هدول المواد ممكن يصير عندهم أعراض قوية أكتر لما يصير عندهم كورونا فيروس، وكمان ممكن يلاقوا صعوبة ليخلصوا من هالفيروس لأنه جهازهم التنفسي بيكون أضعف من الشخص الحافي أو العادي اللي ما بيستخدم هدول المواد. With the stay-at-home order, there's an increased risk for us to misuse these drugs that we have at home or these medications. So why, with all of these changes, with us staying at home, we are more stressed, we are more bored, and we have a little bit more of curiosity. So a lot of times adults are going to, reach into their cabinets, see what medications they have whenever they are stressed and they're sitting at home. For children and youth, they could be bored, they could be, having extra time, so they might reach into cabinets, especially little kids, that they haven't reached into before. and maybe accidentally open a bottle of medication and take them. For youth, they might be a little bit more curious, especially with more time on their hand, and seeing a bottle of medication could trigger them to, using these medications. That's why it's really important for us to kind of get rid of those medications, especially expired ones, and ones that are just extra. So if we had a dose, a few months back, we didn't finish our dose, we didn't need it anymore, it's really important for us to get rid of it in a healthy and safe way, and I'll share those ways with you today. So هلا نحن قاعدين بالبيت، وهذا الشيء ممكن يزيد خطر سوء استخدام الأدوية الموجودة عندنا بالبيت. So مع هدول التغيرات في ضغط، ملل، وفضول أكثر عن كل الناس. So البالغين بالعمر، اللي بعمري عمر آبائنا، كلياتهم قاعدين بالبيت وعندهم ضغط أكثر من الأيام العادية. من العادي يفتحوا الخزانة أو يفتحوا الدواليب ويشوفوا عندهم أدوية ممكن يستخدموها ليتخلصوا من هدول الضغوطات اللي عم بيحسوا فيها كل يوم. الأطفال الصغار هلا عندهم وقت أكتر، وممكن يبدوا يفتحوا دواليب أو مجرات ما كانوا فتحوها من قبل. والشباب والناس شوي أكبر ممكن يصير عندهم فضول وبدهم يجربوا هدول الأدوية أو المواد المدمنة اللي ما مجربيها من قبل. لهالشيء من المهم إنه نتخلص من هدول الأدوية اللي موجودة عنا بطريقة صحية وسلمية، وهلا رح لكم كيف ممكن تخلصوا فيها منها. So a lot of times when I say, what do you do to get rid of your medication, 90% of the time people are going to tell me I either throw it in the garbage or even flush it down the toilet, or just rinse it down the sink. I'm going to tell you that both of these ways are really unsafe and unhealthy. If you're going to throw it in the trash, it could be putting other people at risk, especially people who have a serious addiction. They might find it and might misuse it. In the long run, flushing those medications in the toilet or putting them in the sink can also be really unhealthy, because that can lead to all these pharmaceutical chemicals to be in our dirt, in our water, and it can also, impact our land, our soil, our wildlife in general, and can even come back to us in the long run. So there are better ways and more safe ways, and I'll tell you about them in a bit. So ليش من المهم إنه نرمي أو نتخلص من هدول الأدوية بطريقة صحية؟ أكثر الأحيان لما بنسأل الناس كيف تخلصوا من الأدوية الموجودة عندكم، بيقولوا لي أنا بحطها بالزبالة أو بغسلها بالمغسل، وهدول طريقتين منهم صحيين، وهلا رح أقول لكم ليش. لما نحن بنرمي الأدوية الزايدة عنا أو الإكسبايرد بالزبالة، ممكن غير الناس، خاصة الناس اللي عندهم إدمان، إنه يلاقوها ويستخدموها بطريقة غير صحيحة أو صحية. ولما بنغسلها بالمغسل ممكن آثار من هدول المواد الصيدلانية بتبقى بالتربة، بتبقى بالمي، ممكن تعرض الحياة أو البيئة تتغير، أو ممكن تأثر علينا بعد مرور وقت كتير. So here I'm going to show you a product that you can use. So this is what we call Dispose RX, and this is a really effective way for us to get rid of extra and expired medications. So here's a demonstration of how to use it, and I'll also share a video with you to kind of demonstrate it further. So what you want to do first is, here you have a bottle of medication. And the pills are on the bottom. So what you want to do is fill it up 2/3 with warm water. Then you want to add your Dispose RX. It's a powder. Close your bottle and shake it up. When you first start shaking it, you're going to hear the pills kind of moving around in there. But after 30 seconds, you're no longer going to hear it. Once you no longer hear it, it's safe for you to throw it in the garbage. So أول طريقة رح أحكي عنها اليوم هي مسحوق ممكن يعطل الأدوية، ونحن بنسميه Dispose RX. So في هون صورة رح بتقلكم كيف ممكن تستخدموها، وكمان في فيديو رح أفرجيكم إياه بعد شوي. أول شيء بدكم تعملوه إنه تحطوا مي دافي بالعلبة تبع الأدوية، املوه طبعا 2/3 بالعلبة، بعدين حطوا المسحوق بالعلبة، بعدين اغلقوها ورجوها لمدة 30 ثانية. أول ما تبدأ ترجوها رح تسمعوا حس الحبوب داخلها، بعدين بعد 30 ثانية ما رح تسمعوها، وبعدين بس ما تعودوا تسمعوا هذا الصوت فيكم ترموها بالزبالة. وهلا فينا نشوف الفيديو كيف نستخدم Dispose RX. So here's a video demonstrating exactly how to use Dispose RX. There is one more step that you see here, and I will talk about it in a few minutes. So that's us adding our warm water, our Dispose RX. This video is also can be found on our Instagram page, which is linked here, and we can also link it later for you to access. So where can I get Dispose RX? So there are two different places and other online sources that you can get it from. So you can either order it from Walmart or get it from LAHC, which is the organization where is providing you this presentation. However, you would have to wait until our stay-at-home order is finished and we are back to work for us to provide you with these Dispose RX packets. So وين ممكن نحصل على هذا المسحوق اللي بيعطي الأدوية أو Dispose RX؟ ممكن تطلبوه من Walmart أو ممكن تاخدوه مجانا من LAHC واللي هي الجمعية اللي عم نجيب لكم هاي البرزنتيشن، بس لازم تنتظروا لبين ما يخلص COVID-19 لبين ما نفتح مرة تانية وفيكم تجوا تاخدوا Dispose RX مجانا. So people are going to say, well, I'm at home, I don't want to order it, I have a lot of expenses, and you know, getting something like Dispose RX might not be necessary for me. So here's another way that you can safely and effectively get rid of medications. So what you can use is coffee grounds or dirt and kind of hide those pills before throwing them in the garbage. And I'll also share a video with you in a minute. So هلا في ناس بدهم يقولوا أنا ما بدي اشتري Dispose RX، ما بدي ضيع مصاري عليه. So فيني استخدم غير شيء. طبعا أكيد في بدايل لهذا المسحوق. فيكم تستخدموا قهوة أو تربة تخبوا هدول الحبوب قبل ما تخلصوا منهم، وهلا رح فرجيكم فيديو تستخدموا هاي الطريقة. This video can also be linked, and we can share that link with you all for later reference. And that's it. It's actually very, very simple. And I'm sure everyone can have access to coffee or even dirt from their own backyard. So the last step that I did say that I was going to talk about is hiding your personal information. So on our pill bottles, there are really important personal information on there. And it's very important for us to kind of hide that, get rid of it before throwing our bottle in the garbage. Whether you're using Dispose RX or even, you know, the coffee or dirt method, it's really important for you to hide that information. So if someone was to find it, they won't kind of trigger back to your home every now and then knowing that you get this exact medication. So make sure to cross out your name, your address, your date of birth, and even the name of medication that you were using. So آخر خطوة لازم تاخدوها قبل ما تخلصوا من هدول الأدوية، وهي الطريقة رح تخبي معلوماتكم الشخصية و قبل ما ترموا هدول الأدوية. وهي الطريقة لازم تعملوها أو قبل ما ترموا العلب تبعكم، حتى لو كنتوا عم تستخدموا Dispose RX أو عم تستخدموا القهوة أو التربن. So خدوا قلم، غطوا اسمكم، عنوانكم، تاريخ ميلادكم، وكمان اسم الدواء اللي كنتوا عم تستخدموه. So as a last note, remember that help is there, whether you're dealing with mental health issues, whether you're dealing with substance use, whether it's you, your kids, your loved ones, your family members, know there's help out there. And here's a list of resources. So LAHC is one of them, Access, CSIS, and we also provided information about 24-hour hotlines like Detroit Wayne. And we also have teen crisis lines. So if you know your kids or kids of loved ones are dealing with any of these things, whether it's mental health or substance use, they can use these hotlines through text or even calling. So قبل ما ننهي جلستنا لليوم كان بدي أعطيكم طرق or organizations اللي فيها ساعدكم. So هون عنا أرقام مختلفة ل organizations فيهم يساعدوكم مثل LAHC، مثل Access، CSIS، وكمان عنا خطوط 24 ساعة عندهم services so مثل Detroit Wayne، وكمان في خطوط للتكستينج المسجنج اللي التينز أو أطفالنا فيهم يستخدمون. So فيكم تستخدموا أي واحد من هدول الأرقام إذا كان عندكم مشاكل بصحتكم العقلية أو النفسية، أو إذا كان عندكم مشاكل باستخدام أدوية أو مواد مدمنة، وأي واحد من هدول فيهم يساعدكم. So again, here is our LHC, our organization. Here are kind of our contact information, our social media information and platforms which you can access for videos like the ones you saw today. And if you have any other questions, you can of course email us or call us, and we'll be more than happy to help you. So هدول links تبع المواقع الإعلامية تبع الفيسبوك والإنستغرام، وكمان في إيميل أدرس فيكم تبعتوا لنا إيميل أو تتصلوا فينا لأي مساعدة. وشكرا كتير. And if you have any questions عندكم أسئلة فيني جاوب عليها اليوم.
Thank you, Omnia, for the beautiful presentation, both in English and Arabic. It was very clear and insightful. What are some of the common questions that you are receiving these days when you do these presentations?
So a lot of times parents are concerned about, having any of these symptoms show up with their kids, not so much with their own self. So it's important to know that any of these signs and symptoms can be seen through our kids as well, not just us. And it's important to kind of pay attention to them and also address them when needed.
Thank you.
So I wanted to say the other common question that we keep getting is, where can we go for help right now during this pandemic? And I just want to remind everyone that help is still available. It doesn't necessarily have to be face-to-face. Please utilize the Detroit Wayne Integrated Health Network 1-800-crisis line, which we have on our slide, and I can repeat here again. It's 1-800-241-4949. And then I see a question here in the chat box. I wish more information can be provided for adults in mental health issues who refuse treatment. How can we enforce help on those who refuse? So this is another common question that we get. The most important thing to do is to really keep speaking to the person about the importance of seeking help and trying to really reduce that stigma surrounding mental health and substance abuse, and to try to take away the shame, because that's the number one reason why people don't want to seek help. Unfortunately, you can't force someone to receive treatment because it's not going to be as effective. They have to be willing, so you can really help them and provide them with resources. And please reach out to us privately if you want us to kind of guide you through that process. But unfortunately, forcing them to seek treatment is not really an option. You have to just continue talking to them, try to reduce that stigma, take away that shame, and just keep talking to them about the importance of seeking help. And I do want to say that yesterday, the crisis hotline reported that there was a 900% increase in calls during this pandemic. Just another point, we're all going through something right now, even if we were not going through a mental health or substance abuse issue before this pandemic. So there's really a lot of help out there. People assume that there isn't during this time, but there really is. So again, if you would like to reach out to us privately, we'll be more than happy to help you through that process and try to really seek that crisis line. It's confidential, it's free, and it's 24 hours.
Sam.
Yes, Dr.
Yeah, just a question to Mariam or Omnia or to Wasim. Talking about stigma. Stigma was one of the major issues behind not being able to deal with or to heal the issue of drug addiction. Now, people, families together at home. Do you think this might give a broad chance to families to deal really with this issue of stigma?
Absolutely. And I think the most important thing is how we address the issue as well. That's really important to get youth and even adults to really open up to their parents or to their family members about having a problem. So the appropriate approach, the right approach is really key here to really get them to open up and seek help. Absolutely.
I also want to add another point. So with everything going online, everything going virtual, I think a lot of people are going to find it as a better opportunity to kind of seek help without anyone knowing. Yes, your family members are going to know, but no one's going to see you going to that office. No one's going to see you getting that help. It's kind of, virtually in the comfort of your own home. And with that, text crisis lines, you can even text them and no one in your family member is going to be able to see it. And even in the long run with those virtual means of getting help, I think they're going to stay simply because it provides more privacy. So I think we're kind of going to not overcome stigma. I think stigma is still going to be there, but we're just providing more options without having people kind of, expose themselves or, be more open about it, but they're going to be more willing to kind of seek help simply because it's a little bit more private.
I have another question to Wasim. Wasim, do you think that as community organizations, LHC, Access, etc., do you think that we are doing well, or we are still far behind from what's supposed to be done to face all?
So there's a lot of work to be done, and I've said this over and over. One organization alone cannot do this work. We have a huge epidemic in the community, whether it's substance abuse or whether it's mental illness, and the more the merrier, I guess. So all these organizations collectively are coming together and they're doing a great job. Are we able to put an end? Were we able to put an end to this epidemic? No. Are we on the right path in providing support, resources, and treatment to families? Absolutely. If you look at for example, in the past 5 to 6 years, or 6 years ago, many people in the community, many families in the community who were battling mental illness or substance abuse, they were not talking about it as openly as they are doing right now. It is because of the work of all these organizations that we are spreading awareness, we are providing resources, we are breaking the stigma that mental illness and substance abuse, it's a disease, and you have to treat it like when you have the flu, when you have COVID-19, you go to the hospital, you seek help. And same thing when it comes to substance abuse and mental illness. There is help available out there. There are professionals, there are doctors, there are psychiatrists, there are psychologists, there are therapists, there are prevention specialists, intervention specialists who are offering, they go to school to be able to provide the state-of-the-art and evidence-based practices to serve the community. So the key starts in, number one, educating families and the community about breaking the stigma, about the importance to seek help and try to humanize the topic of substance abuse and mental illness, and provide resources to these families, offer follow-up, and it's gonna start with the person who is battling addiction. You cannot force a person to go and seek help. We get a lot of calls into our office from people, my son has an addiction problem, can you help him? My question will be back to them is your son, is he asking for help, or are you forcing him to seek help? Because you cannot force someone. You cannot take someone, put him in a headlock and tell him, hey, you're going to seek treatment. It has to start with the person himself or herself. So a lot of that has, and there's work that needs.
Thank you, everyone. With that, we have come to the end of our broadcast. We'd like to thank LAHC and Wasim and Omnia and Mariam for joining us and presenting this very valuable presentation to our parents. And thank you for everything that you do to our community. Dear parents, we will see you next week on Friday For another family engagement broadcast, we have the superintendent will do a live broadcast with you. She will take your questions directly, Ms. Nawal Hamadi. And then afterwards, we're going to have a presentation about depression by Access. During the week also, there will be the various principal live broadcasts. Please check your emails and check also the school's social media remind messages for more details on that. This broadcast will be saved on the Facebook page and also on YouTube. So feel free to share it and watch it at your convenience. Thank you again, everyone. Have a great weekend and a safe rest of your day.
Thank you for the opportunity, and inshallah, Ramadan Mubarak to everyone.
To you too.
Thank you.
Ramadan Kareem.
Ramadan